And I am so happy to have Yudhajit with us today. Thank you so much, Yudhajit, for being part of the session.
Thank you for inviting me here.
When Ishan spoke about you and I looked you up, I was like, oh my God, he's done so much. He has written about so much, and he's passionate about a lot of things. So Yudhajit has studied from Christ, so a lot of you would probably know him from there. And he's currently the associate professor at St. Joseph, assistant professor at St. Joseph. What is the difference?
The difference is about the amount of time you have worked, your total time, and your qualification. So be associate, you need to work for around 10 years with a PhD, and so long way to go.
No. You're going to reach there pretty soon. So he's an assistant professor, but he does have his own private practice as well, and he has 1,000+ hours where he has done therapy. So we are looking to have a lot of good informative things from you. Today's session is also partnered with Urban Vault. Obviously, they are our venue partners. And we also have some wonderful snacks from Delishu Bakes. Unfortunately, Sachi and Shayan, who do all of these yummy treats, they dropped off the snacks and they had to leave. But they are our snack partners as well. So I thank them before we go on to the session. So I want to tell a little bit that most of you who are here are therapists, practicing therapists or aspiring therapists. But there are also a few people who have signed up to learn about ADHD. So we'll try to keep the conversation relevant for everyone. But if you have any specific questions, please do ask. We are more than happy to answer any questions, whether it is psych or not psych. We are happy to answer any questions. Yes, Yudhajit?
Definitely.
Excellent. So we are going to start with a mock case today, so that it is relatable and we can understand what we are talking about. The mock client name is completely randomly chosen, is Aditya. Aditya is working in an MNC currently. When he was young, he had problems with staying focused. He had been called, scatterbrain, but very creative at the same time. And he had occasional mood swings, emotional outbursts. His parents thought he was not focused on studies the way he is supposed to, and he's not able to do what he can or go up to his aspirations because of his laziness, maybe not ability to try. So that is how he was, but now he is currently working in an MNC. At the MNC, even though he is able to do all of his work well, sometimes he has troubles finishing his work on deadlines, and he also has burnout. He misses meetings. He's not able to keep his meetings. Not able to attend them. After working for a while and having a lot of issues regarding work and keeping everything in line, he thought it was depression or anxiety, and then he reached out to a therapist to figure out what is going on with him. Okay, and he doesn't like to take medication. He's hesitant to take medication. And he also doesn't want to talk about it at his workplace because of workplace backlash. The workplace does not have any kind of help for dealing with people with neurodivergence and everything. So he's worried about that. So this is his background. I hope that kind of gives you some context on what we are going to talk about, right? So Yudhajit, the first thing that came to my mind when I was looking at a case study for this conversation is why did Aditya think that he had depression or anxiety and not ADHD? So what is the difference between somebody being anxious about something or even having anxiety or clinical depression to ADHD?
Okay, so it's very common for people with ADHD, adults with ADHD that is, to go for a referral or a checkup because they feel they have anxiety and depression. Now, the reason why that happens is because anxiety and depression are the most commonly discussed mental health conditions. We don't really discuss, let's say, bipolar disorder, or we don't really discuss ADHD, autism, schizophrenia, body dysmorphic disorder online much. Most of the common discussion that people do have is about anxiety and depression. And well, I'm not going to say that there is no stigma associated with anxiety and depression. There definitely is. And in our country, in any country in the world, we always think that our country or the developing countries have higher rate of stigma. Not necessarily. Even developed countries also have a very high rate of stigma regarding mental illness. But when you say to talk to people, tell them that I'm feeling anxious, or I'm feeling really low. People are more likely to take you seriously rather than when you say I'm just feeling distracted, right? You're feeling distracted because of a lot of reasons. It doesn't really have to do anything with the psychopathology also. You can be distracted just because you're worried about something. You have a test tomorrow and you're distracted today, right? You have a meeting tomorrow, you have an appraisal meeting tomorrow and you're distracted today. And also one of the reasons why people do come up with anxiety and depression as the major concern for any consultation is that these are the most commonly visible symptoms in almost all mental health conditions. You rarely have a mental health condition that is not associated with anxiety and depression. That is, you might not see that in DSM or ICD as one of the diagnostic features, but when you work in the field for some time, you would realize that almost all of your clients have some sort of anxiety and depression, right? Their diagnosis might not be GAD or MDD, generalized anxiety or major depression, but they will have some sort of anxiety and depression, right? Now, coming to your question about how it's different, so there are a few things that are different when it comes to anxiety, depression, and ADHD. Now, of course, when someone goes to you first, there is no way to know that this person has ADHD unless they have had a previous diagnosis during childhood or any other time during their life, or even in adulthood with a different therapist or a professional. It's not possible for you to know that immediately by talking to a person, because they're going to say that I feel very low, or they're going to say that I feel very anxious. Now, why they feel anxious, how they feel anxious are something that you have to look out for, right? So one of the first things that we usually notice or usually take down when you're taking down a client's history is about the duration of the problem, right? So if we look at the duration of the problem, we usually see when the problem started. Now, if someone has ADHD, their problems would have a chronic course. They might not be able to say when it started. They might say stuff like, I feel like I've always been like this. Or I can really recall a time when I was happy or I was not anxious, right? In case of GAD or MDD or any other depressive disorders or anxiety disorders, people are likely to have a particular triggering event. If you look at how we conceptualize cases in case conceptualization, if you have studied psychology, you would know that even counseling, clinical, whatever you have studied, you would know that case conceptualization, right? And one thing we look out for is a triggering event. Now, people with an underlying undiagnosed condition like ADHD that is chronic, or even autism or any other stuff like that, that is pretty chronic, people would rarely have a triggering event. They might say that even since I can recall, I have always been like this. In school, I was not very open to people, or in school, I always felt like I was different. Now, for them, they might feel like the difference is because of anxiety and depression. But it's very unlikely that someone who has only anxiety and depression saying that they've always felt that they're different, right?
So, Yudhajit, when it comes to Aditya, let's say, even though we say adult ADHD, it doesn't mean that what you're saying is it suddenly came up. Aditya would have had ADHD from childhood.
Definitely.
And it has gone undiagnosed until he realized, okay, this is interfering with my work. This is interfering with how I can perceive and what I can do.
Yeah.
And that's when, so adult ADHD doesn't mean that it is, it starts in adulthood. Is that right?
Yeah, I mean, ADHD cannot start in adulthood in the first place. It's a neurodevelopmental condition. You are either born with it or you are not born with it, right? It cannot suddenly come up in adulthood. What does happen is that because for people of our age, people who are in our 20s or people who are elder to us, of course, I'm taking us as the baseline, right? People in our 20s or 19 years of age or 18, people of this age group, right? The Gen Zs. Most of us did not have any structure in place to diagnose ADHD. If you go back to our school, I mean, I'm in my mid 20s. When I grew up, the early 2000s, there was no idea that there's something existed, something called ADHD. You are either a normal child or abnormal child. Abnormal child means you had intellectual disability. That's it. There was nothing else. If you do not have ID, that means you're a normal child. You do not have any special needs, right? So there did not exist any structure, any awareness to diagnose children with ADHD back then. And the thing become more complicated if you're a good student. If you're a good student, in our school setting, good student means you're scoring marks, right? It doesn't matter how you were doing socially, if you're having friends or not, if you're getting bullied or not. It doesn't matter. If you're scoring marks, you're a good student, right? You're fine. Nothing is wrong with you. So if you're a good student, no one is ever going to see that you're distracted all the time or that you're extremely talkative, that you disturb other people in class because you're so bored in class. You cannot follow instructions because you feel the teacher is too slow. No one's going to look at these things. They might bring this up in PTM. They might say like, oh, you know, your child talks too much to your parent, but they're like, yeah, fine, it's okay, he's a good student. I mean, that's something that happened to me every year from my nursery till 12th. Every standard I've been in for the 15 years of my school life, this used to happen every year, every PTM. The teachers would tell my mom that, okay, you know, your child is very talkative in class. He doesn't listen to the teachers, but he's a good student, so it's okay. So, like, when I got diagnosed or when I was going through the process of diagnosis, I could see that these things all make sense. But back then, no one knew that this could be there because there was no awareness. Secondly, because you're a good student, right? Even today, you go to a lot of doctors or therapists, you say that, okay, I have a hunch that I might have ADHD or autism also. They were like, oh, how can you? We are already in college, you cannot have ADHD. So that is always there, this kind of misunderstanding of what it is. A lot of doctors still do not believe that you can have ADHD as adults. So if you look at older literature, if you look at your psychopathology textbooks, a lot of them, the older editions, they would talk about how ADHD goes away in adulthood. As a child goes older, the ADHD goes away, right? What we realized over the last 10, 15, 20 years is that it doesn't go away. What happens is people either learn to just live with it, suck it up, and you know, there's nothing going to change. They always feel like they're different from people and that they are a complete mess, but they're like, okay, whatever, I've lived with it for like 10, 15, 20, 30 years, and I can just live with it, and further as well. So these people are not going to report that they have ADHD because they have never been diagnosed. Had they been diagnosed in childhood, and if you screen them again, they might also say that, okay, I can just live with it. Now I can live with this statistic used to be considered as it's not there anymore, right? But I can live with it doesn't mean it's not there. It just means that I have the resources to live with it now, which I did not have back in childhood, right? Now, people who get diagnosed in adulthood, they do not have the resources to cope with it anymore in adulthood. So what happens for a lot of people is that in childhood, because school is a very structured setting, right? You go to school at this time in the morning, you have this many number of hours in the day, and you go through the hours, you sit in the classroom, teacher comes, takes class, leaves, all that's there. Everything happens. You are a passive observer there. Then after school, all the structure is gone. You go to college, you don't attend classes, nobody cares. I mean, unless you're at Christ, you have 85% attendance. But even you have 85, that's it. Otherwise, no one cares, right? No one cares if you're coming to college or not. No one cares if you're bunking class. You go to the first hour, you leave for the rest of the day. There's no structure. There is no oversight that are going to keep you in place. So when the structure goes away, people realize, oh, my life is falling apart, right?
So the structure and the plan and what to do next, is defined. That helps for a person with ADHD. And how can they, without externally that structure coming through, how can they do it themselves? If they come to therapy, if Aditya comes to therapy with you, what would you ask him to do in terms of getting ahead of the symptoms and pulling everything together?
Okay. So the structure thing is correct in the way that having a structure definitely helps. But one thing with ADHD is that the ADHD brain craves for novelty. If you have too much structure, then the brain cannot comprehend. It cannot adhere to that. It cannot, simply cannot. If you have a proper structured day where everything has to follow a timetable, the ADHD brain cannot do that. Which is why there is an entire joke among the ADHD community that we have a lot of planners, but then none of the planners actually work because we make plans but it never follows through on plans. It has happened so many times with me. Like I would, before going to bed, I'm like, okay, I would wake up in the morning, I'll do this, I will do that, this at this time. And then you wake up next morning, every plan goes out of the window. Today also it happened. I thought, okay, I'll wake up at this time. I had to participate in research. I was a participant in research. I'll do that, and then I will have my lunch, take a shower, come here, have my day. Then I realized I woke up 1 hour late, and then everything just got postponed by 1 hour. And then I realized, by the time I realized it's time for lunch, I realized I already wasted 2 hours of my day for no reason at all. Right? So all this plan you make, it all goes out of the window. What does help is having a semi-fluid structure, right? So one thing I always tell my people who ask me how my job is going, because I had a job, after I finished my master's in 2022, I joined a company for around 2 months, 1.5 months actually. I realized that, okay, too much structure, I cannot do this. I need my own flexibility, right? I cannot do this anymore. So I left that place. The reason I like my current job is that it's a very flexible working time. We do not have a particular time when you have to report to the university. You go anytime you want. You have to be there for 7 hours. That's it. You clock in at 10, you leave at 5. You clock in at 8, you leave at 3. You clock in at 11, you leave at 6. It doesn't matter when you go. You just have to go there anytime and be there for 7 hours. And also the only structure that exists for my day at work are the classes, the hours that I have for classes. Right? So that's the only structure. So I know when I have to work throughout the day, how I have to work throughout the day. But when I start my day and how I work throughout the day is very flexible for me because I have flexible working hours. Right? So this flexibility is what helps. If I have to work with Aditya, what I would work with him is not creating a plan, because again, as I said, we are amazing at creating plans. You ask a person with ADHD to create a plan, they'll give you a detailed plan of everything. Then the day before they're supposed to implement the plan, they're like, I don't know, like let's not do this, right? So planning is not going to help. What is going to help is having someone to hold that person accountable. Because accountability is something that people with ADHD often lack, not because they do not want to be accountable, because their brain simply cannot comprehend time. It's called time blindness. Right? Time blindness is an actual condition. If you want, you can check out Dr. Russell Berkeley's talk on time blindness. It talks about how it's an actual condition where people with ADHD do not perceive time as they pass properly. Right? So accountability, lack of accountability comes from that. It also comes from a lack of object permanence. I'm pretty sure you remember object permanence, Piaget's work. People with ADHD often lack object permanence. So if something is out of sight for a long time, it's out of mind. Having another person who can hold a person accountable, saying that you need to do this work at this time and you're supposed to do this, and this is what happens if you do not do this, helps. We also introduce a concept called body doubling, where you work with someone, preferably someone with ADHD, but it can also be someone without ADHD as well. Anyone who you can work with sitting in front of them, or it doesn't have to be in person, it can be online, also virtual space, but you be with them and you check that person's progress and that person checks your progress. So you are being, in a way, being held accountable, be there for that particular time being and do the work that you're supposed to be doing instead of your mind for being all around the place and you're getting distracted all the time.
Those are some really, really good suggestions, what you have mentioned. But let's talk about Aditya, right? Where his workplace does not understand this. They are not open to this. And Aditya is really scared of going and speaking to his managers and saying, you know what, this is why I'm having problems with the deadlines. This is why I'm not turning up to meetings, because I am time blind. I forget. So how can he approach his work life and without actually revealing that this is what is going through him?
Okay. Okay, so what you said is very common things with people with ADHD. But I think the meeting is not because they forget, but I think he's not turning up for meeting because he's bored of meetings, because meetings are extremely boring. Even when
You've
we
never
have,
been in one of Zensible meetings, so
it's okay. I mean,
I'm just
we
joking.
get to have meetings every week in our department, and then I'm like, oh my god, when will this end? Because most of the time it's very boring. Again, pretty important stuff, but very boring stuff as well, right? So I don't think it's possible for him to not reveal his situation to anyone, right? It's, I mean, if he had a better workplace, then this accommodations would have been made for him. Like, okay, if you do not want to attend the meeting, you can skip this number of meetings in a month, and then you'll be sent the minutes anyway. So you can just read through the minutes, right? But most corporate workplaces in our country are not like that. I do not work in corporate, but I have a lot of friends who work in corporate, and I feel very bad for them because the way the entire thing works in that setting. Sure, they get paid very well, but does that really compensate for the amount of pressure they have to take, the amount of corporate gaslighting they have to go through, right? So I don't think it's possible for him to not reveal it to anyone. He might have some people at workplace whom he can rely on, whom he feels like these are the trustable people. These are the people I can trust with personal information. It doesn't have to be everything about your life, you know. It can only be about the certain aspects that are being affected by ADHD. So if you feel like, you are not being able to manage deadlines, you can have someone who you can body double with at work. So you can just talk, walk up to them like, hey, you mind if you work together here, and just let's do our work side by side. We are not working on the same thing maybe, but you do your work, I do your work, and after maybe 30 minutes, an hour, we check on each other how much you have worked, right? So he doesn't have to say that I have this condition, right? He just say that, okay, this is something I struggle with. Can you help me working on these things? Again, this is only about his professional life, right? Personal life, he doesn't have to mention to anyone if he doesn't feel like it. Professionally, you can have these small things that he finds difficult, the small behavioral aspects that he finds difficult, right? So finding people who can trust without divulging the information about him, without saying that I have this condition, but I have these problems and I'm working on it. I just want to work with you. I just want you to help me with this. You don't have to go beyond your way, right? But whatever you can, just if I'm in a meeting and I'm falling asleep because I'm bored, just wake me up. Just give me a push, I'll just wake up. Small things like that, right? It doesn't have to be anything great. It's very important for as a therapist also to know that if you do not set this realistic boundaries with your client might be very overburdening on other people. So when you're setting goals or expectations from other people in therapy, when you're talking about these things, you always say that you cannot expect other people to do your work. People are anyway helping you because they are nice, they want to help you, but that doesn't mean you can depend on them for everything. So you have to be very careful when working on these things to set a good boundary that I'm working on these things and I want your help with these things only, nothing else. You don't have to go beyond your way. That communication is very important because otherwise people might feel like if they help a person once, the person will become completely dependent on them. So yeah.
So you mentioned about keeping, if possible, whenever possible, having somebody to work with and keep each other accountable. Uh, do they keep like short goals, like keep themselves, okay, in the next 1 hour I'll finish this, and then they and try it out, and then instead of doing a full length plan for their entire day, they just plan one after the other. That way they keep themselves,
Yeah, definitely. The people with ADHD has a planning problem. So we plan grand, make grand plans. I will finish everything, 3 days of work in one day only. Problem with that is, again, time blindness. You do not know how long 3 days are. You feel 3 days and one day are the same thing in time. They're not the same thing. The thing is, it helps, of course, it helps to break down your work in smaller steps, because then you are setting deadline not for the entire thing but for each steps separately. So I break down this one day of work into chunks of 3 hours, right? So three components of 3 hours, 9 hours. Now I have the next part becomes when it comes to becoming accountable for your work, whether you are finishing this in 9 hours or not. Thing is, people with ADHD often struggle with deadline. They compensate for that either by doing everything before time, So you are asked to put this, let's say this data that you had on a system, right? That's your work. You have 2 days to do it. You will either do it an hour before your deadline is supposed to end, because emergency and ADHD brain works amazing in emergencies, or you're going to do it in 1 day, put the data, make the entire system automated, do all extra work in 1 day, right? No one asked you for that work, and you're never going to be recognized for that work, right? So again, so what helps is having someone to hold you accountable, because let's be honest, people without ADHD might be able to self-regulate, self-reinforce, and all those things. We learn about self-reinforcement. It's a part of behavior therapy where you give yourself reinforcement for being able to complete a task. But people with ADHD find it very difficult to do that. They'll be like, oh, okay, I work for 30 minutes, I take a break for 5 minutes, the 5 minute break will go on for 30 minutes, and they'll realize, oh, anyway, I did work, so why not give myself a reinforcement for working for 30 minutes, right? I mean, that's how the brain works. It all works on how much a reward you can get for working, right? So again, breaking down things into smaller parts, setting yourself deadlines, and holding yourself accountable. What also helps is gamification of your task. So you know how we play video games and we have this small quests in each level we have, and side quests along with it. Each quest you do, you gain rewards. It might be, you know, in-game coins or levels. You gain experience, you level up, and you unlock more and more things. Could be gadgets or anything. So gamification, of course, you're not going to earn anything, but seeing your task as a game, right, where you have something to do, there is a reward at the end of it, and making it down into steps, in levels, starting from something easy to something harder, more difficult to do. This thing also motivates, because again, you are seeing it not as a mundane task, even if it is, but you are seeing it as something that can give you some reward. You're trying to reframe the entire thing as a sort of something positive, something interesting, something helpful, even if the task is very mundane. That also helps. But again, having someone holding you accountable is definitely very helpful.
So when we started talking about this, you mentioned that with ADHD, they would have felt they always had this and not a sudden onset. Is this the only way that we can differentiate when we come to therapy between anxiety or depression and ADHD? And we always talk about this part where they may not have focus, they go through multiple different things. That kind of aligns with anxiety. But how does the depression part come into a picture, and how do people or therapists differentiate between the two, and how far back in their history do they have to go to identify this?
Okay, so the depression part of ADHD often comes from a realization that you are not achieving what you can. A lot of people with ADHD have been told that they are very smart but lazy. They're intelligent but doesn't work hard, right? And you grow up listening to all these things. And you also realize that you could do so much more, but then every time you try to do something, you are just, no, I'll just scroll on my phone today, right? So you also hear stuff from people, you internalize those things. Oh, I'm smart but lazy. What's the use of being smart if I'm lazy? It's not laziness, it's perhaps the ADHD paralysis, right? It's definitely not laziness. Laziness is when you do not feel like working. People with ADHD feel like working. They feel it a lot. I need to work. They know it that they need to work, but they cannot work because their brain is not helping them to work at all. So you know that you can work, but you cannot work, right? And if you do not know why that is happening, it's very easy to blame yourself. Oh, I am at mistake for this. And what happens when you keep blaming yourself? Depression. It's the most common outcome when you keep blaming yourself. Self-blame is one of the most common component of depression. If you look at Beck's triad, right? It's a negative view of yourself, the world, and the future. I am bad, the world is bad, and nothing is going to get better, right? So this I am bad component becomes very ingrained. Now, one ways in which therapists can identify this is by, again, the duration of it, and see if this I am bad is associated with certain conditions. So for example, someone with ADHD, they might feel that There are few things I'm good at, but I'm bad at everything else. I'm bad at work, I'm bad at studying, I'm bad at maintaining relationships, I'm bad at everything, right? But oftentimes this can also come from MDD. Major depression can also make a person feel like they're bad at everything. What usually helps is focusing on depression initially and then seeing how the outcome is. So people who often go to a psychiatrist, they are often initially prescribed antidepressants, SSRIs mostly, right? And SSRIs don't work. In therapy, you do CBT for depression, it doesn't work. They might feel like, yeah, I know I can reframe this, but what's the point of reframing this? I'm anyway bad at it. I know I'm bad at it. I have performance, I have all the proof that it is bad. So how can I dispute this thought? Right? When you see that despite constant effort of how good you are at treating depression, it's not going away. Every time you treat it, it either doesn't work or it comes back. That's one of the indications that something is going on inside this person. Some intrapsychic thing is going on. It could be anything. It could be depression, some major concern. It could be, instead of MDD, it could be PDD as well, persistent depressive disorder, right? Which doesn't really go away. It could be PTSD, CPTSD, ADHD, a lot of things. But this indication when depression keeps coming back, it's an indication that something is wrong. And this is not just MDD that's happening, because MDD happens in phases. If you look at depression, depression happens in phases. A person is not always depressed. So their depressive episode might last for, let's say, a month. But after that month, they will have a couple of weeks, 3 weeks, or a month of a period of reflection where they do not have depression. That doesn't mean they're all happy and gloomy and happy and blooming and they're running around. That's not the case. They will feel like, okay, today I can feel something. I don't feel a kind of despair in my heart, right? But in ADHD especially, what is often said that people with ADHD have depression without sadness. So common thing in depression is the intense feeling of sadness. People with ADHD might often feel an intense sense of emptiness. It's a constant feeling that I'm not good enough, but it's not exactly sadness. It's the thing that, oh, I'm not good enough. Am I that worthless? Without the sadness, because your brain is not cooperating with you. But when you're coming up with negative thoughts, that's when ADHD brain is very good. Oh yeah, you are very bad at everything, right? So in a way, this is one of the ways in understanding this. If it's episodic, if it fluctuates, because in ADHD it might not fluctuate much. There might be a constant feeling of sadness, of emptiness, of an idea that things are not right. I am not right. I am wrong. So I can't do anything properly. And of course, if despite constant treatment, it doesn't go away at all, it keeps coming back again and again and again in very small intervals. I mean, depression is considered, MDD is considered to be something that remits, right? It comes back, but then there might be years between another episode after proper treatment. Something might happen major and the person might go into it. You can treat that, but this recurrence of depression in ADHD might happen in weeks, and it's very fluctuating. Again, in people with depression, MDD, they will have weeks of depressive episode, weeks long. In ADHD, it fluctuates. Today, the person is very depressed. Next moment, they might be very happy, and then again depressed very much. Again, so it keeps fluctuating like a sine wave, like a seesaw, right? It doesn't really have a proper end. It keeps fluctuating all over the place. It's of course associated with how ADHD regulates emotions and executive functions. But yeah, if it's constant, if it's fluctuating, it's something else. Because I remember when I went for my diagnosis, I got diagnosed at Enhance. I prefer that because comprehensive care, you have everything in one roof, very cheap. So you just have to pay for your medications, that's it, nothing else. So I remember the doctor, I mentioned to the doctor that, I'm feeling very depressed. That was before the diagnosis. I was going through the process of diagnosis. And the doctor was like, okay, how long does a depressive episode last? I said, 2 days. And the doctor was like, huh? I was like, yeah. And then I am happy for 3 days and 2 days. So initially I remember they put down a bipolar 2 in questions in brackets, but then it didn't make sense because bipolar 2 doesn't fluctuate so much. And they also put a rapid cycling cyclothymia question mark. And then when the ADHD thing happened, they struck all of those off, and like, yeah, this makes sense, right?
So you mentioned about SSRIs, right, for depression. For ADHD, especially for children, they do prescribe medications, especially so that they can get their developments in line. Otherwise, they are not able to get their developmental milestones. Are ADHD medications prescribed even for adults, especially high functioning adults who have, like you said, executive functions are all, working? So, do they prescribe medications for ADHD, adult ADHD especially?
Okay, so yes, they do. Adult ADHD has similar treatment as children. There is no difference in treatment. You either get stimulants or non-stimulants. They're both kind of treatments that you have. One thing I'd like to say about executive function, you said, right? So adults who are high functioning, they might be high functioning because they have compensatory behaviors, not because their executive functions are working well. So people with ADHD, unless they have been diagnosed early, treated, medicated, executive function is not something that is working very well. You might have different compensatory factors that is helping you work very well, but there is this constant feeling that I can't plan well, I can't keep time well, I'm always late on appointments, and I can never follow deadlines. It's all about how you plan, how you follow through. One very common thing is working memory problems. You cannot multitask. You think you're good at multitasking. You feel like I'll do 10 tasks at once, but then you realize I'm not doing anything. I not remember what I'm doing. It has happened to me so many times that I'm having a conversation and then I realize that I was not listening to the person at all. Because when you're conversing, you have to listen to a person. If you remember what they're saying, it's complete working memory, right? If you look at the Badley and Hitch model, it's a complete working memory, all the phonological loop and visual spatial sketchpad and all the thing. I recall that I don't remember anything. And then I'm like, oh, can you repeat? Couldn't hear. So this thing doesn't go away. I remember we had this neuropsychological test we were learning in college back in my masters, and I did well in all the tests. Every test that was there, Tower of London, you say, everything I was good at. When it came to working memory, my working memory was as bad as a person with, an old person, let's say. My working memory is non-existent almost. My long-term memory is very good. You ask me some obscure fact about random things in the world, I might tell you about that in detail for the entire day. You give me something now, if you ask me to recall it immediately, I might not recall it. Right? So working memory and all these things don't really become fine when a person grows up. It's not only about how you are not putting in effort, it's about how your brain is, how your brain structure is. Memory, all these things are about how the brain interacts with each other. It's about the connection between the neurons. If you look at an ADHD brain, the amount of gray matter in crucial areas which are associated with executive functions are lesser. There is lesser connection between the neurons in those parts of the brain. What medication does in children is that it helps grow those connections. If you look, it has been seen in different research as well. If you look at researches on how ADHD medication stimulants affect the brain after they have been medicated, there have been increased number of connections between brain regions. These are important for executive function, for emotional regulation, all these things, right? In adults, the same thing happens, but of course, the adult brain is, of course, much less plastic than a child's brain. So, if you medicate a 6-year-old compared to a 40 years old, there's a huge difference between that, right? But adults also have similar medications, exact same medications. There's no difference. Adults might have a higher dose than children because body weight, metabolism. Adults are heavier, so they need higher doses. But same thing happens if you're taking it properly. They also increase, your connections between neurons. Helps in executive function to a certain extent. What it doesn't help is boredom. ADHD medications don't help with boredom. People with ADHD are always bored, chronically bored of everything. That doesn't go with medication, but then you learn that okay, just because I'm bored doesn't mean I need to throw a temper tantrum at this point. That is something medication helps you understand and learn through therapy. But the boredom is something that I guess we kind of have to live with throughout our life. This is something I struggle with a lot. I'm bored of everything in life, right? So that's something that doesn't help. But yeah, medications help to most people if you can manage the side effects. That is, of course.
So for someone, I like the point about boredom. For someone like Aditya who comes to you, they may or may not be taking medications. What are some, given that goals or not, especially if they are over a long period of time, it doesn't work. What are some goals that you will as therapist or you can as therapist give Aditya so that he actually meets them?
Okay, again, that would of course depend on what Aditya wants to focus on now. Again, as I said, if the workplace, it will be finding people he can find support in, right? If it's about interpersonal relationships, that is something people with ADHD find difficult because, again, especially if it's a long-term relationship, forget about it. Out of sight, out of mind. Probably gonna forget that person's existence for days. I mean, I know, I can relate to that. When I kind of reading about it and I'm like, oh damn, I wish I knew that back then when I was in school. But yeah, if it's about interpersonal relationships, of course, emotional regulation is something that needs to be focused on because emotional dysregulation is one of the major striking features of ADHD. It's not a symptom though. If you look at DSM, it's not a symptom. It's the difference between symptom and feature of a disorder. But emotional regulation is very unlikely to have a person with ADHD and them not having emotional dysregulation, right? So emotional regulation is something I would like to focus on because again, this fluctuation of emotion, right? One time you're depressed, next time you're amazingly happy, and then you're bored. This thing creates issues in relationships because if you're bored, you're more likely to cancel plans. You're made with your friends when you are very happy. And then your friends are going to misunderstand that, oh, you never follow on your plans. You are completely a person whom you cannot trust at all. Right? It happens. It might seem like a slippery slope, but it happens a lot in people with ADHD. So I would, of course, like to focus on emotional regulation. I would like to focus on their professional career, what they're doing in their professional life at this point, and if possible, helping them learn the executive functions properly, how to plan well. Again, if, as I said, people with ADHD planning problem, we plan great instead of planning small bits and pieces. I'll help them create plans better, help them have a better sense of self-understanding because once you have ADHD, you cannot help but live with it, right? You cannot pray this away, you cannot meditate this away, you cannot hope this goes away suddenly one day out of your life. So the shame that comes with having ADHD, that's not helpful at all. The shame comes from a place where you do not know why you are doing what you're doing. Once you know why you are doing what you're doing, once you become very self-confident that, okay, I know what I'm doing, why I'm doing this. That also helps. But of course, self-consciousness has to come with accountability. You cannot say, you cannot just, make plans with a friend, keep them waiting for at a place for 2 hours and then turn up late and say, I completely forgot. You should know why this is happening. It's time blindness. But at the same time, you also need to have accountability, which is also something that needs to be worked on in therapy. Because a lot of time when self-consciousness is not associated with accountability, people start using therapy talks as people are weaponizing therapy talks. All this talk about, oh, you're gaslighting me just because someone disagreed with them. All this idea about you're violating my boundaries just because someone demanded them to do something that needs to be done immediately. Right? So it's very important to pair accountability with self-consciousness, that you know why you are doing what you're doing, but then you own up that what you did, if it has a negative effect on someone else, it was not something that is a very helpful thing to do, right? And maybe I'll incorporate mindfulness components as well. I'm a mindfulness-based practitioner, so I can never leave that out of anything. So yeah.
Tell us more. Why would you incorporate mindfulness for ADHD? How does that help? How does that help you?
Okay. So when you talk about mindfulness, I'm pretty sure most of people think of mindfulness as meditation. People with ADHD cannot meditate, most people, right? I can. I know how to meditate. I can meditate for 30, 40 minutes, but that's because I've trained in it for a long time. I spent a year in therapy learning how to meditate, right? So I can do it because it's learning. But most people without training, or most people do not find interest because you have to sit with your thoughts there, right? And you have to let your thoughts go. As we say, it's leaves on rivers. You have to see them and then let them go, right? That is something that people find difficult because your brain is constantly generating thought with ADHD. I always thought that our brain is always thinking stuff. That's what my idea was for 22 years of my life, until I realized, no, that's not true. People's brain actually don't think all the time. And I was like, are you kidding me? Is that really how your brain works? It doesn't think all the time. And I was like, wow, my brain is thinking till the time I fall asleep. I wake up in the morning till the day at night, and fall asleep at night. It's always thinking something.
Even when you're sleeping, it's thinking something.
Yeah,
sometimes.
and like I saw a meme on Instagram a few days ago. It said people with ADHD, and it said this. It was a doll sleeping, right? And the next panel, this doll had eyes open, and it said, "Where is my birth certificate?" At 3 a.m. at night. It happens. It happens. I suddenly wake up at night and like, where is my stuff? I need it immediately, right? So all this, your mind, what we call in ACT, acceptance commitment therapy, is your mind is like a monkey. It's always going to jump around from place to place, right? So if you look at ACT does have component of meditation, but actually do not have to do meditation to be mindful of your actions. ACT focuses on being aware of your behavior, why you are doing what you're doing in the first place. It starts from that acceptance. So I would incorporate mindfulness to help Aditya or anyone in that situation to be more self-conscious, to work with the shame itself, to increase the awareness how my behavior is affecting other people and myself as well. Because your behavior is affecting you, the first person, and then others. If you're not aware of how your behavior is affecting you, then you're not going to be aware of how your behavior is affecting other people. So mindfulness can help with that. It doesn't always have to be about sitting down in meditation for 40 minutes. It's not that. It's about awareness. It's about, your mind is always talking. So why not turn that to yourself? Why not turn that to a situation where his mind is always giving you feedback on what you're doing, right? Where your mind is telling you that, okay, this is something you're doing, and then after the outcome, you sit down and realize, okay, your mind is telling you that the outcome was not correct. Use your always monkey brain to your own advantage. It's like putting a monkey in a treadmill, or the treadmill is generating electricity. It's going to run around, jump around, but that is also helping in some way, right? That helps in mindfulness. I'm pretty sure you can do it in other techniques as well. I just find it more helpful to do with mindfulness. So my perspective again, that's it.
Yeah, absolutely. Having a lot of toolkit in your tool bag to help clients always works, rather than sticking to one thing. So before we go to questions from other people, I just have one last thing. Would you ever recommend that families are also involved when it comes to therapy for Aditya, let's say?
Yeah.
Is there any situation where you would say, let's bring in somebody from your family also, let's use them, let's talk to them as well? Is there any situation like that?
Okay. See, in a cultural context like ours, which is very rooted in community and family, I feel involving family is always very helpful, right? And one funny thing about people with ADHD is that once a person gets diagnosed, their entire family starts getting diagnosed. One of their parents, or both their parents, their grandparents, their best friend, their dog, everyone gets diagnosed with ADHD, right? That's because you realize that it's a genetic thing. It's highly genetic, and if you have ADHD, it's very likely that someone else is also going to have it. If not your parents, your grandparents will definitely have it, right? So you start seeing a pattern, and then everyone starts getting diagnosed. And the reason your best friend thing happens is because you are very likely to vibe with someone who you resonate with, and that's very much likely to be a person with ADHD, because one of the major things I believe is because how you converse. People with ADHD often go on long talks, jump between topics to something else, come back to a topic again, then go to something else. People without ADHD feel very annoyed by this thing, because when you're talking, you're expected to talk in a linear manner, and you're not doing that, right? But if you see two people with ADHD talking, amazing stuff, that's something spiritual. In my opinion, they can talk about random things, jump to topic, something else, and then come back to topic that happened day before, and then talk about like there's no gap in between. So it's very much likely that the person you relate to closely is also going to be the same, and very much likely that they're also going to have ADHD. So I think involving family when it comes to adults is tricky, because adult means their family members are going to be older, right? Their parents, as you said. Are they willing to understand is the question. Because even in children we see, right, when parents take their children, the most typical ADHD child is very obvious, jumping around all over the place, climbing things and all, and you can see them and then you're like, oh, this child definitely has ADHD. Even in situations like that, the parents are not willing to accept a diagnosis, because no, my child is very normal, nothing is wrong with my child. Like, your child is literally throwing a temper tantrum because he cannot get what he wants and he's hitting other kids. What do you mean your child is normal? Sure, every child is a child, is special. normal doesn't mean the child doesn't have special needs, right? So parents are not willing to understand that their children, and we doesn't matter how well we grow up, we're always children to our parents, right? Your parents will, no matter if you're in 50s, 40s, your parent is going to call you out if you do some nonsense. They're going to do that, right? That's how parents are. And it's very unlikely for a lot of people that the parent will understand that my child has a thing. They're like, no, my child is always good in studies. How can he has this problem? This only happens to abnormal kids, right? So this still might be there, and the older you get, the less likely that you would be, open to new ideas, new things that you have not heard before. It's not nothing to do with the generation per se, but it's a very common human thing. As we grow older, we might also become like them only, right? So it's very tricky whether we should include them, because if we do, it becomes better. If just living with their parents understanding their child, why they are doing what they are doing, is very helpful. But today's world, not a lot of people live with their parents. I am not from Bangalore. I don't live with anyone. I live by myself here, right? But if I was living with my parents, my mother, it would be very helpful for her to know. She knows, and she is very supportive. I have sent her stuff to read, and she's like, "Do I also have it?" I'm like, "Maybe. Very likely that you do." Because we see stuff in my grandfather, her father, very much. So yeah, like oftentimes involving a parent might lead a parent to get a diagnosis, which is helpful for the parent as well, not only for the child, the ward, or the parent. At the same time, we have to understand whether the parent is open-minded or not, because if not, then it makes no sense for you to give them any options or trying to involve them, because they're not going to understand at all. And if it's an adult, then it's not compulsory to involve parents. In children, you have to. Adults, if the parents can, very good. Otherwise, it's okay. You do what you can do.
That's good. Thank you. So now we open up for questions from any of you. There is a mic. Let me just bring it over.
So you were talking about how ADHD kids are like kids or maybe even adults are considered that they have potential, they're smart but they're not able to achieve it and stuff. So outside therapy, what can an individual with ADHD do to change that change or work on that fact? Like most of them would have confirmed to the fact that no matter what I do, I'll still be like this, because there could have been a lot of events that reinforce what is already said and what they think of themselves. So, what do you think is the key to changing that?
So this idea that smart but lazy, it often comes from a place where your environment is not very suitable for your existence. Schools, um, if you look at how schools function, instructions are verbal, very slow, something that a person with ADHD cannot focus on. Verbal instruction as a kryptonite. They always say that you cannot follow verbal instructions. I cannot follow verbal instructions. Give me in writing, I'll do it. I might not read the entire thing, of course, but I'll do it. But verbal instruction I can't follow. So this idea that smart but lazy, it often comes from a place where what you can do and what the environment requires from you are not matching. Without therapy, if you ask me, I think again, this might not apply to everyone in our country, especially knowing that we are a developing country and not everyone has similar privilege. And if you're sitting here, that means we are quite privileged people actually. But if we have the privilege, if a person has the privilege, it's always suitable for them to find a work that they like, that suits them, right? A corporate job is the worst thing a person with ADHD can have. The worst. It's absolutely something you cannot, sitting in front in a cubicle for 9 hours a day is something you cannot do. Your brain is not helping you at all. People do it because they need the money, they need to earn, they need to feed their families. But is this something that's going to help them? No, it's going to make them feel even worse that they are wasting their time on something they do not want to do. What helps? Tasks, work that has a lot of novelty, right? So I realized over time that practicing in the field is something that I do not want to do full time. This is some because I found it very restrictive. I found it lacks the connection with other people around you that you need. People with ADHD need that connection, right? You need to have people around you to a certain extent. So therapy work, let's be honest, it's a very lonely task. It's a very lonely job. Especially if you're practicing privately, you do not have anyone around you. Even people who have practiced organizations, right? They have so overburdened with work, they do not have time to socialize with people at all. Now, I came to academia just by chance. I qualified NET. I came for the interview. I was like, let's try, and then I got it. And I'm like, oh, let's try it. Let's try something new. It was not because I wanted to be here, but like, let's try something new. I'm anyway bored of doing only this. Then I realized this is what really helps me because I like studying. I like reading. This is something I can continue doing. My work is not very scheduled, as I said, right? And you won't believe me, but when you are standing on the other side of the classroom as a teacher, it requires you to be in that space for that 1 hour that you are teaching, and that requires that requires a lot of novelty because you cannot take a class in the same manner twice. You have to keep improvising. You have to keep improving. There will be a lot of times when you have the material ready, but you'll forget stuff. You will. I mean, if with ADHD, of course you will. People with ADHD will also forget what they're supposed to teach. Then improvising, that challenge that you have, right? The constant need to upgrade yourself, the constant need to find out new ways to capture your students' attention. Let's be honest, we have been on the other side, and I know students cannot hold their attention for 1 hour. It's impossible to do it. And I know in my class there will be people with ADHD as well, and they cannot do it. They can do it even more, but people without ADHD also cannot sustain their attention for 1 hour in a classroom setting where there is light is not there, not proper sunlight, not proper ventilation. I know how colleges are, right, mostly. So this is something I found helps me a lot. So I feel like finding a work profile that suits you, your needs, your necessities is something that can be very helpful to challenge the belief that I'm smart but lazy. Because when you're really motivated, when your work has a lot of novelty, when your work has a lot of challenge that you find easy to do or very like moderately challenging, you're going to feel like, okay, this is something I really want to do. So the laziness factor is not going to be there anymore. You're lazy because you're bored of it, not because you're actually lazy.
I have a follow-up, sorry. I come from a corporate background and I was a HR of that organization for a while. So the part where you say that corporate job is not right for ADHD, it immediately stings me. So as a HR or as an entrepreneur, if I want to make my organization friendly even for everybody obviously, but for people with ADHD, what can I do as a corporate?
Okay. I wasn't definitely meaning to offend you. No, but the reason I say
using it as an opportunity to educate some of the corporates who are out there. I am not offended. Don't worry.
No, the reason I said that is because, well, the thing is, corporates can also be very fun. If you look at how corporates work in the US, UK, European Union, Australia, they are actually fun places to work at. You work only for the amount of time you're supposed to work at, and then you go home. No one can contact you outside your work hours. The problem is not corporates per se, but corporates, how they function in India. They function like family-owned businesses. They're going to make you work for 16 hours a day if needed. And I mean, it's really bad. And people tend to joke about HRs, I know that. And if you open LinkedIn...
Yeah, there is a lot of jokes about...
Yeah.
You ask Manju, he'll tell you.
No, if you open LinkedIn, you see that people are joking, corporate employees are joking about HRs, and HRs are saying, like, why are you joking about us? We do such important work. It's a very common thing you see on LinkedIn. Even on Twitter, if you see corporate Twitter is also there, Reddit. I spend time on Reddit, I get to see that there, people making fun of HR. But I think that HR, if allowed to work, can actually help initiate a change in the corporate culture by making accommodations for people, right? I feel one of the things that affects people with ADHD in corporate is the work environment itself. Again, the same thing about classrooms. Is there proper lighting? Not artificial lighting. Is there proper sunlight? Is there proper ventilation? Those things are very important. Not for people with ADHD, but for anyone to function properly. Artificial light is cool. We need that. I get it. But it doesn't beat sunlight. Proper filtered sunlight. It's amazing resource for yourself, your body, and your awareness as well. Our body's biological clock works on that, right? Apart from that, having rooms that reduce different kind of stimuli, sensations. One thing people with ADHD struggle is sensory sensitivities, right? I am personally sensitive to all kind of stimuli. I cannot tolerate sunlight, bright sunlight. I got my glasses photochromatics. When I go out in the sun, it automatically turns black because I cannot tolerate sunlight. I cannot tolerate loud noise. I find it horrible to live in a city because people are always honking for no reason. Or people are doing random stuff. They're fighting on the road or something. Like, it's still better in Bangalore. I don't know where you are from, but Bangalore traffic is annoying. I get it. But people don't honk a lot here compared to where I come from. I come from Kolkata. People honk there for no reason. You might go to the empty street, people will go the entire street honking for no reason. And I find it annoying, and it puts me in a freeze reaction where I don't know what to do, right? So I'm sensitive to light, sound, touch, smell, taste, everything, right? All the 5 stimuli you have, I'm sensitive to all of them. So it's very difficult for me to work in a place that has a lot of sunlight, but I need the sunlight as well, right? So if corporate employees could have places where they can work without a lot of distraction from stimuli, that's also helpful. If they could have places that provide opportunities for proper connection with their colleagues instead of superficial, just corporate talk, but proper connection with their colleagues, I feel that can be very helpful. I think having proper mental health resources, right? Proper mental health resources, and of course, it's not about having EAP or other mental health resources, but also about the kind of culture that is there in the company. The problem is, again, not the people who are trying to do, because I know people in HR, or a few of my friends work in HR, and I know they're trying so hard. They're trying so hard to change stuff. Is that the change has to come from somewhere, right? And once it picks up, it picks up. It goes across the system, across the chain of command. It has to pick up small things, right? Not giving strange deadlines. So you give a person with ADHD say a work now and tell them that they have to finish the work by 8 p.m. tonight. They're going to freak out first, and then they will do it. But the freaking out part, right, isn't necessary. At the same time, if you give them a long deadline, like you're giving it today and you have to submit it 2 weeks later, they're going to forget it.
Or no deadline at all.
Yes, yes. So make things less ambiguous at work, right? I know a lot of corporate talks are very ambiguous in nature. You see those reels about corporate meetings, right? Jokes about meetings and all those things. Does it really need to be so ambiguous? Does it need to be so, I don't know, pretentious in a way? It could also be very simple. It could include a lot of graphics instead of long list of stuff to do. Why not put it in a graphical format? Why not just, instead of saying things to people verbally, why not send everyone a mail? We have this thing, right? A lot of meetings could be mails. So why not choose mails over meetings when meetings are not necessary, right? So small things, these things don't have to be huge change, but small things that individuals can do to help them people can actually work a lot, go a long way to help people with lifelong conditions.
Yes, you are forgiven then now. Swar.
Yeah. Hi, thank you so much. I am loving the session. So
Now you can.
okay. So I have a question. If you are a ADHD individual and and are working on it as an individual or as a therapist, I would like to know both the sides of it. How positive psychology, affirmations, your own work, since the acceptance is already there now, because when you vocalize it, when you keep saying it again and again, I don't think it is adding. Like just like cancer, a cancer patient, if they really want to cure it, they will move out of the space, or they will address it in a way that it is actually out of system. And there are people who have cured it to an extent that they never look like they actually went through that. So yeah, I would love to know what is your insight on that.
Okay, I mean, I get the analogy, but of course, cancer is something you can treat. You can completely treat in cases. ADHD is just how your brain is, right? It's structural difference in the brain. You're born with it. But yeah, positive psychology. When you talk about how we see it, we talk about adopting a strengths-based approach. So strength-based approach acknowledges that you have certain difficulties, right? It says that, okay, you are not able to do these things, but then these things are something you can do. So why not build your skill in the things that you cannot do by focusing on the things that you can do, right? So it's not focusing on only the negative, that you are bad, 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 bad. It's also not saying that you're only good, 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 good. You're saying that you are a whole person that includes both things you can do and things you cannot do, right? Both your strengths and weaknesses. So I feel it's very important for any therapist to adopt a strength-based approach, where not only for ADHD but any condition actually, where you acknowledge that you have these problems and we will work to it, but then also focus on the good things that you have, the things that you can do, because despite there being a lot of commonalities across disorders, every person with ADHD is different. There is a saying in the autistic community that if you met a person with autism, you have met a person with autism, not the autistic community. Same thing in ADHD. If you met a person with ADHD, you met a person with ADHD, not the entire spectrum of ADHD, group of people with ADHD, right? So it's very important to understand where a person stands. If a person is too deep in a lot of shame, then you really cannot immediately go to a strength-based approach, because they might not be able to recall anything that they're good at, right? So at that time, it's very important to focus on the shame itself and work on the shame. But then working on the shame itself can be inspired by positive psychology, right? So how you approach it? As a therapist, you're supposed to be realistic in your expectation. You cannot expect a person with ADHD who has difficulties in, let's say, executive functions, suddenly become completely genius at it. It cannot happen, but you can teach these things. These things, our brain is plastic at the end of the day. We can learn stuff. How much you can learn is individually determined, but we can learn stuff. And how you teach that thing to a person is going to determine how successful you are in helping a person with ADHD.
Thank you. Thank you. Last question. After that, we will tackle more questions during the networking part. Yeah. Or you can take that. You may have to keep it a little close. Yeah.
Okay. First of all, thank you so much, Veda. The first thing, as a person with lived experience, the first thing I saw was how long the net is going to be. So thank you so much. And correct me if I'm pronouncing your wrong. Yudhajit, I think it's been a very relatable event so far. So I have 4 questions. You want very short ones. Do you want me to kind of rattle off all of them, or should I just review one by one?
One by one, please.
Like I said, one is the last question, the last topic that she took was the support of the family, right? In that you kind of really covered the parents, assuming that we're talking about teenagers and children. I'm trying to understand partners over here and spouses especially, because I had ADHD even before ADHD came to India, because my aunt was working in the UK and thankfully I got diagnosed very early on. So there's always a tug of war with my partner, with my mom, with my sister, siblings. So I want to understand the support. What kind of support can be extended to the family members, including spouse and siblings and partners?
Okay, yeah, I think that's a really nice question. I think her question is focused on parents mostly, so I only focus on that. I think Veda's question is focused only on parents, so I focus, yeah. But I think, yeah, for adults, I think you're very correct that in adults, I think spouses hold a more prominent position in day-to-day life compared to parents, because they're more like, even if you shift cities, you have to shift with your spouses, right? By the spouse. So I think if their ADHD is so prominent, so visible that it actively affects their interpersonal relationship, which let's say is likely to different extent for different people, it's very important to include the spouses and children if possible, and screen the children as well, as much as possible to a certain extent, because spouses are, again, in adult, spouses are first people to be affected mostly, right? Apart from the persons of dealing with it. If possible, I would feel like designing a treatment plan, keeping the spouse in the cycle, in the chain of command, is something that's very important. If needed, then separate therapy session with the spouse that addresses the things they are going through, that is going on because of their spouse's ADHD, something that can also be done. Also, of course, couple session where they can work through it. It's very important for the spouse to understand that these are the conditions that a person has, and these are things that they will show, right? So if the person is forgetting to bring stuff while work, bring stuff for important stuff for home while coming back from office, it's not because they don't care about their families, because they actually forget about it. Like, the small things actually create a lot of discord in couples, is what I've seen. Again, I don't know much about couples, of course, but this is what I've seen from people around me. Like, the small things create huge conflict over time. So I believe addressing these things in therapy and incorporating them is very important.
Especially laundry. Second is, so in the US, I've been tracking this particular startup called as Shima, where they talk about ADHD coaches. So as a therapist, I want to understand from you, is there anything fundamentally different from an ADHD coach that they are being kind of certified by these two institutes in the US? And what otherwise therapists are doing? So that's one thing, and maybe a follow-up question to that would be, if it's the same, then what are the modalities a therapist can start working on so that they can be at par with the ADHD coaches that is very expensive to do, by the way. So just trying to understand the relationship between ADHD coach and the modalities a therapist can start.
Okay, coaches is always a sensitive topic in therapy, isn't it? Okay, so the thing is, in the US, I've seen a lot of ADHD coaches online on Instagram and LinkedIn. It seems like a lot of them have gone through a lot of training to be that. In India, anyone can claim to be a coach. I can today wake up tomorrow and call myself a coach, right? I saw something called a high stake relationship coach yesterday, where this person helps women to find rich men as partners, some coach like that. So you have these things in India, right? So a lot of so-called ADHD coaches in India are not really coaches, to be very honest. This claim to be one. But what I've seen in the US and what I've observed with people is that coaches usually work on the day-to-day tasks, the behavioral components of it. So this thing we talked about, how to plan tasks, how to schedule tasks, and how to follow on through the accountability and all these things. This is something coaches focus on, right? Because therapists you're going to meet once a week. A coaches, I have seen that they're more available to a client compared to a therapist, all these things. But when it comes to more complex issues like executive functions, emotional regulation, these are the things a therapist is more equipped to deal with, because they have a bigger repertoire of techniques compared to a coach. A coach is a well qualified, well trained, well learned coach is of course helpful when it comes to doing your daily tasks, maintaining the quality of life that you need. But the deeper issues, I think that is where a therapist can actually come in and contribute. I don't think therapists need to be competent or as good as coaches, because I think they work in different planes altogether.
What modalities can they do to specifically equip themselves for ADHD?
I don't think modalities as such are important. If you look at therapeutic techniques as well, most of them are helpful. I mean, for most of conditions, all therapeutic techniques are helpful to a different extent. Um, Anything works as long as the person is learning all these things. So yeah.
And not one last, so the part that I wanted to ask was, with so much of information on CPTSD, even though they're not there in DSM, is a lot of people kind of talk about how ADHD was an adaptive response, like Mate. So, is there any truth to it? Because I've been really like digging into a lot of work, and I'm not
Okay.
able to kind of conclusive.
Okay, so anyone who knows me, anyone who has followed me over time, they know that I'm not a fan of Gabor Mate. Maybe, yeah, his work on addiction is something that's really nice and I really like it. ADHD, I feel it's nonsense, to be very honest. There is not much evidence to suggest that ADHD is caused by trauma. What we know today is that people with ADHD are fundamentally different from other children, right? And what happens when you're different from children? If you look at it, children can be extremely cruel at times. People with ADHD, I don't know a single person with ADHD who has not been bullied in their life in some way or the other, right? And you are mostly bullied because you are different in some way. And what happens when you're being constantly bullied, when you're constantly being put in situation where you're being forced to question your self-worth, your entire self as a person, that is likely going to give rise to a traumatic experience. So what is today what we accept, the consensus among the scientific community, is that ADHD is mostly inherited, genetic in most of the situations. We have also found markers, genetic markers, which can show that a person is likely to develop ADHD. Um, of course, things would be helpful if we could track ADHD before birth. So that is, of course, going to be helpful, because then you can see that these are the things that definitely cause ADHD. But we have not reached so far today. I hope to do. I follow a lot of neuroscience research, and amazing work is being done in neuroscience research. And you never know how 10 years down the line where things would be. But what you accept today is that because people with ADHD are fundamentally different, they're more likely to face traumatic experiences in life compared to people without ADHD. And it's not only in relational context like bullying and all. People with ADHD also, because of their impulsivity, of novelty seeking, they're also likely to put themselves in situations where they might be traumatized by other things as well. So, and these traumatic effects then affect their ADHD, which exacerbate the condition even further. So, although you might be functioning to some extent, and if you go through something traumatic, you're going to be in a situation where your things become worse and you cannot function at all. So, in that situation, you cannot say trauma caused the ADHD symptoms to appear. We can say that these things exacerbated the symptoms. But yeah, I know a lot of people do not want to hear this, and but I will say what I find from research. Of course, my work is idea about things are mostly based on research. Research says that ADHD is not caused by trauma at all. But yes, ADHD, being born with ADHD is likely to cause you to be in traumatic situations. Yeah.
Thank you, Yudhajit. Sorry, tongue twister. But this was so good. You lots of very good questions from the audience, and we'll have a networking as well. Thank you so much for all the information.